From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's staff story is Bon Secours Health System has launched Good Help Connections. In a press release dated February 2nd, 2015, Bon Secours Health System announced the creation of a new, wholly owned, taxable subsidiary corporation called Good Help Connections. The purpose of the new corporation is to better serve communities by helping partners execute on and optimize the use of electronic health record installation. This, of course, will help improve their care and reduce the cost of care. The idea is to provide Bon Secours ConnectCare implementation and support services for those partners who choose to implement Bon Secours ConnectCare. As you know, Bon Secours ConnectCare is Bon Secours' electronic medical records system that has already helped Bon Secours provide extraordinary care and reduced cost. By providing implementation and support services, Good Help Connection intends to help partners build an integrated and transparent record to support population health management, expand their ability to serve their communities, and improve the integration of care delivery among all providers. Build strategic partnerships to support other health systems and develop innovative tools and intellectual property that supports the transformation of healthcare and the ability to create sustainable operating margins. Dr. Marlon Priest, Chief Medical Officer for BSN, is quoted as saying, "Good Help Connections will provide application implementation and support services both to BSN and other health systems that share in Bon Secours' vision of higher quality care for our communities at a lower cost." Good Help Connections may also hold intellectual property developed and owned by BSN, such as software code for various order sets and interfaces. To which CEO Rich Statuto added, "Good Help Connections will bring the experience, talent, and successes of the Bon Secours ConnectCare team, information systems experts, and other clinical transformation staff to our partners." BSN's experience with an extensive development of the Bon Secours ConnectCare platform provides opportunities to either deploy Bon Secours ConnectCare to partners and or to provide installation, consulting, and related services to them. BSN and its partners and affiliates have the potential to improve clinical integration and other strategic alignment through EHR partnerships with those who may wish to explore these kinds of opportunities together. Bon Secours Good Help Connections, bringing a whole new understanding of what it means to be good help to those in need. In other news, well, it's that time of year again, time for mid-year reviews. Every year, BSN conducts employee reviews at mid-year, then again at the end of the year, fiscal year that is. This year's mid-year reviews are going on now through April the 10th. Now, we had a chance to sit down with Chief Nurse Executive Andrea Mazzuccoli to get her take on mid-year reviews, and you might be surprised by what she had to say.
Mid-year reviews are an important time for both the employee and the supervisor. And so I think one of the most important things is this is not a passive act for an employee, and it shouldn't be just an obligatory task for a supervisor or leader. It's really a time to connect about two things: our business objectives and our personal development. As a visible testimony to the commitment Bon Secours has in our employees to take time for that professional development. In many organizations, performance review is an obligatory one-year event. Our health system says no, our people are too important, and we're making an investment that mid-year we're going to spend dedicated time with our employees. It's about making a commitment to invest in yourself.
Mid-year reviews. If you've already had yours, Good for you. If not, be sure to log on to SuccessFactors and complete your self-assessment before you meet with your supervisor. Finally, telemedicine. Normally when we think of telemedicine, we think of doctors communicating with their patients at home or at a fixed location. But Bon Secours, always the innovator, has embraced telemedicine on another level, in the hospital.
Robot simply means, in its bare minimum, interfacing between the surgeon and the patient a device. And that device might be a large machine, it might be a small object like this. So the robot never does the surgery on its own, and my robot never makes rounds on its own. I've never come in the morning and heard that, oh, I heard you made rounds, and I actually didn't. The robot came to life. These are simply machines that we place between us and the patient to aid us. The robot that we're talking about today enables me to see a patient, to visualize what they look like without actually being there. It's called a double robotic. I guess you could call it an iPad on a stick with wheels. And it enables us to wheel up to our patients and get up close and look at them, and they can see me, and I can certainly get a look at them and the numbers up on the monitors and all, and brings me a little closer when I'm farther away. I tend to look in on my patients the first post-operative night. Our patients, after a long day of surgery, will very frequently come off the breathing machine and be fully awake early in the evening. The idea or concept of what we call telemedicine has been around for a couple decades, but not really used extensively until the past 5 or 10 years. With my iPhone, I can pull up the robot activated from anywhere. The big advantage I have with that is the ability to connect to them whenever I want. I used it initially to try it out and see how it worked. And now I use it frequently, almost every night, for a patient who's a fresh post-operative patient who has just come out of the operating room. It gives me a little bit of peace of mind. We have spooked a few people, unfortunately, as we come down the hallway. It's a very silent device, and if someone is not aware of it or not looking up, suddenly an iPad appears in front of their face. I've had quite a few oohs. It takes a little getting used to for the staff, but the patients don't seem to be surprised that much. They'll take a look and they recognize my face, and again, usually burst into a big smile.
Bon Secours Heart and Vascular Institute at Bon Secours Hampton Roads. Innovation lives here. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.